name is Megan Ryan. I'm a native Texan, lover of plants, flowers, and gardening. I'm a lifelong learner. I'm always planning for an upcoming travel adventure. And I live with common variable immune deficiency. Nearly 20 years ago, when I was out of college and beginning my career, I was diagnosed with common variable immune deficiency. I was thankful for a rather quick diagnosis and that a treatment option was available. My doctor specifically advised me to focus on a positive, that the treatment options that were available to me were going to be successful. I heeded his advice and focused on the positive. I'm thankful at that time the internet wasn't what it is today. I did not go wildly searching out life expectancy or anything like that. Actually, there wasn't that much information available at all, except a copy of a pamphlet that a doctor gave me from the National Institutes of Health. Over the years, I've become a very resilient person. I've had some ups and downs over the past 2 decades, even as I strive to live a very healthy lifestyle, focused on diet, exercise, good mental health practices, and being very compliant with my treatment plan. In those years, I've never missed an infusion through hurricanes, ice storms, and more. I've learned to say no at times to manage my energy levels and accept help from others. I've learned that I can bounce back even when I get really sick. In 2008, I was thankful to learn about the Immune Deficiency Foundation. I've been very fortunate to attend many of their biannual national conferences as well as local events to learn more about the advancements in my disease, as well as meet others who live with the same diagnosis. Until my first national conference in 2009, I had never met anyone with my diagnosis. It was also after my first national conference that I advocated to my doctor for moving from IV infusions every 3 weeks in the clinic to weekly subcutaneous infusions. I maintain copious medical history and medical notes online that my husband, mom, and a close friend have access to in the event I need someone to speak on my behalf. I go to doctor's appointments with written questions to show that I am proactively managing my health care. I often communicate with my specialist and their team via MyChart, an electronic medical records system. Communicating this way sometimes eliminates the need for an office visit, or lab work can be ordered in advance of that office visit. I've had to use telemedicine services while getting ill out of town, and being able to share my medical history file gave the treating physician a good indicator of how he should provide care to a person living with a primary immune deficiency. I've taken my weekly infusions of gamma globulin on the road to more than 20 countries and 4 continents so far. My favorite locations being Glacier Bay National Park in Alaska and the entire country of Turkey. I've helped educate patients and healthcare providers about primary immune deficiency diseases and have served as a peer coach, small group support group leader, as well as a speaker at plasma donation centers. I've even had the opportunity to visit a plasma fractionation facility to see how the product that I infuse each week is made from human plasma. Nearly 2 decades after my diagnosis, I'm full of hope about the future, thanks to my healthcare team and the legions of plasma donors who make my treatments possible.